A client arrives at the emergency department after a motor vehicle crash and is noted to have significant abdominal distension. Which diagnostic test should the nurse expect the provider to order first to evaluate the client? Answer choice A, a urinalysis test. B, a CT scan of the abdomen. C, hemoglobin and hematocrit levels. Or D, a bedside abdominal ultrasound. All right, let's break this question down like a healthcare detective. In this scenario, we have several clues and keywords like significant abdominal distension. The actual question is asking which diagnostic test should the nurse expect the provider to order first. This implies we're going to do every single one of these answer choices, but in what order? And particularly, what's first? Knowing that I'm going to do all these first, I'm going to ask myself, which one of these would be best to detect internal bleeding and hemorrhaging? Because that is what would drive the plan of care and show us what we need to do first and how we need to attack the problem at hand. Looking at answer choice A, we know this test checks the urine for blood, which may show kidney or pelvic injury, and that's important. However, the sample must be sent to the lab, so the results may take a little longer. B, we have a CT scan of the abdomen. A CT scan is very helpful for finding injuries, but as a matter of fact, the CT scan can be done later after the patient is stable. Answer choice C, dealing with the hemoglobin and hematocrit. This is a very crucial blood test because it helps measure blood loss. However, even if the patient was hemorrhaging, this lab result would not tell me where the hemorrhaging is taking place. And that leads us to answer choice D, bedside abdominal ultrasound. First off, I like the fact that it's bedside. Let's go right to the patient. We're not wasting any time. Let's get there immediately. And with this abdominal ultrasound, it's like getting a streaming video of what's taking place inside that abdominal area. This test can be used to quickly check for any life-threatening internal bleeding. Therefore, this is going to be our answer choice. The best way to approach an NCLEX style question is to think through the material and process the scenario. Understand the actual question. Connect the dots by connecting the clues to the answer choices. Then bring your knowledge in to solidify your answer. The clues are there. The challenge is to connect the dots.